So Carol says we've had a very productive relationship, but you wouldn't believe the fire in some of our meetings. Believe me, she's not afraid or does not shy away from representing nurses across this province and RNAO. And I think it's fair to say, I think you'd agree, first and foremost, Ontarians and patients. So thank you, Carol, for that introduction. I want to, and where's Angela? Where is Angela Cooper? Angela, I know, it's good to see you as well. I want to acknowledge Angela. All of you know, I'm sure, that come April, I think Angela, her responsibilities are going to increase even more. It doesn't mean that Carol's are going to get any diminished, I'm sure. But Angela, I look forward to continuing a productive relationship. And if you'll allow me, Shane Chouinard, who's with us as well, I had the opportunity to, it was remarkable actually during question period that there are so many people that stood up to introduce nurses from their ridings, from their communities, to acknowledge RNAO was here with us today. And I had that opportunity as well. But I'm glad that I also had the opportunity to acknowledge Shane, because he, as you'll hear shortly this afternoon, brings an experience which is absolutely essential for us to understand not only the issue of homelessness or precarious housing, but the social determinants of health as well. And I have and with people like Kathy Crow and others as part of your panel, I have no doubt, and Joe Cressy, who's a good friend of mine. I have no doubt that that's going to be an absolutely fantastic and productive panel session. But back to the matter at hand, and thank you for the opportunity to be with you today. I certainly appreciate the invitation to join you. We know that, and you more than anyone know, that RNAO is a strong community of caring and dedicated individuals. But I have to say, and I know that I still won't be doing it justice by saying just this, but you have a fierce and passionate leader at your helm. And Doris, I know you're like going to be tweeting out this, but I was talking about you. I was talking about Doris, and she never stops. And Doris is, together with RNAO, Carol and RNAO, Doris is absolutely and has been absolutely instrumental in the creation, with all of you and with RNAO, of incredible initiatives that continuously change the lives of people across this province. And so, frankly, you know, and I haven't always had the tools available to realize some of those initiatives, but my job in many respects has been quite simple, is to listen to RNAO and to listen to Carol and to listen to Doris. And I mean that with all sincerity, and we have a strong relationship, but, and I said this to Doris just before coming up here, and no doubt it'll get me into trouble, especially if any of you belong to other associations or advocacy groups. In the nearly 4 years that I've been health minister, actually in the 8 years that I've been a cabinet minister, I cannot think of an association or advocacy group that is stronger and more effective than RNAO. I really, and my staff over here are going to get worried with that, but it's for a few reasons. It's because of strong leadership, of committed leadership, of strong membership, and doing the hard work right before coming to government to help us provide better care and to make the right investments and the right decisions. Doing that hard work of making sure that the initiatives that are brought forward, the challenges that you seek to reduce the barriers of, all of those opportunities, that you do the research, you make sure that the foundation is evidence-based, and you come forward with very specific, well-thought-out initiatives, and then with the talent and the ability to work with government, which can be an art form in itself, to prove to us why we need to support these initiatives with investments. And so that is certainly helped by the strong relationship that that I have with Doris and Carol and others in our RNAO. But it really has been a tremendous relationship. And I think we know and we can see that because of that collaboration, there are quite an impressive variety of initiatives that put patients first, and we can see them, and some of them have already been implemented and others are on their way. For example, and in large measure, again, due to Doris's and Carol's and RNAO's advocacy, as of April 1st, all nurse practitioners in this province will be able to independently prescribe CT and ultrasound and X-ray for their patients. And I don't need to explain to any of you why not only is that important for patients, but why it's so logical and simple in terms of why it's the right thing to do. And this is one of a number of examples, I guess, of our commitment working together to expand scope of practice. And at the end of the day, it will allow and it will enable nurse practitioners to be better at what they do and to fully practice their profession according to their abilities. It will give patients more choice as well on who they want to provide the services that they receive. So it makes all the sense in the world. And RNAO as well has also played a key role in the changes that we've proposed to the Workplace Safety Insurance Act. And I should, as a sort of an asterisk as well, we have a separate table which is co-chaired by myself and Minister Flynn, Minister of Labour, which focuses specifically and wholly on violence against health workers across the healthcare system. And we know, and I know we all agree, that there is absolutely no defense for or justification for a single act of violence against any healthcare worker, including nurses, anywhere in the healthcare system. But tragically, it is all too common. And so this table has been set up in the first instance looking at how we can reduce and prevent and provide the supports necessary and the culture necessary to eradicate violence in hospitals. And now we've moved on to the second area of long-term care as well. But with regards to, and I know you'll like this, I don't think I've had the opportunity to say this directly to RNAO, but as the changes to the Workplace Safety Insurance Act in December, Kevin Flynn, again the Minister of Labour, and myself announced the critically important expansion of PTSD, post-traumatic stress disorder, that presumptive diagnosis. We announced in December the expansion of PTSD presumption to all frontline nurses. And again, because of the hard work of RNAO and our nurses, but also all of us recognizing that you deserve it, that it's necessary and required. So I'm pleased to say on that you can expect to hear more good news about these changes in the coming budget. Now, RNAO has also fought to ensure that all RNs can continue to independently initiate psychotherapy services. And I don't know if it's in your policy document. I suspect it is. Certainly, I would imagine you reiterated it. Yes. She's going to show me exactly.
Several of our leaders are right there applauding you. Yes.
So, check mark. So I'm pleased to say that I support her in this. I support RNAO in this, absolutely, and have directed the College of Nurses to ensure that RNs can and will continue to independently initiate psychotherapy now and once the Controlled Act is in force. Now I'm worried that every time I mention something, you're going to walk over at the policy document, and hopefully we'll keep checking.
I'll hold her down.
Yeah.
We need to produce another one.
You'll have to produce another policy document, no doubt. So RNAO know, and all of you know, it goes without saying, the outstanding work that nurses have done and are doing around the issue of mental health and wellness. And I know RNAO is a champion of this issue as well, and we support you on that. RNAO has also been a vocal advocate for the increases in minimum wage, $14 now, $15 January 1st of next year, because, and not just in this province or across this country, but around the world, RNAO members and leadership have seen the devastating impact of poverty and its impact, obviously, on through social determinants of health on negative health outcomes. So all of you and RNAO representing you continue to voice the critical need to improve the quality of life for our most vulnerable populations. And it's not in here, but I'd be remiss if I didn't sort of have a sidebar on another issue which is important to RNAO, and I know important to all of you as well, which is pharmacare, national pharmacare. And some of you may know really, well, certainly since becoming health minister, I mean, I sort of surprised my provincial and territorial health ministers about 3.5 years ago when I first put this on the agenda, or sort of sprung it on them. It wasn't even on the agenda. My belief that not only is national pharmacare absolutely essential, but it's also achievable. And when we know that 1 out of 10 families across this country don't have access to medicines, don't take their medicines because they can't afford them. And a recent study that just came out that showed about 1 million people cut back on their food and their heating in order to make that effort to be able to afford prescribed medications. And about 1.6 million, I think, don't fill their prescriptions. And as a doctor myself, I can't even count anymore the number of times where I had that interaction with a patient or a family writing a prescription that I knew that that child or that parent required, but knowing full well that they wouldn't be able to, that they wouldn't be going to the pharmacy to fill it because they couldn't afford it. So national pharmacare, and we took a big, it's like incomplete, but a big first step here in Ontario with OHIP Plus, where, just to sort of bring you up to date, that's 4 million Ontarians between the age of 0 and up to their 25th birthday, 4 million Ontarians that now can themselves, if they're youth, with their parents, if they're children, can go into any pharmacy anywhere in this province simply with a prescription from their nurse practitioner or their doctor and their health card or their OHIP number, health card number. And absolutely free of charge. No annual deductible, no upfront payment, no co-payment, no reimbursement, absolutely free of charge. They can get access to 4,400 medications, which is our entire formulary here in the province. And so far, about, I think the number we're at today is about 800,000 individuals in that age group between 0 and their 25th birthday. 800,000 unique individuals have had those prescriptions filled in the province, and it amounts to about I think we're up to about 1.7 million prescriptions that were filled. And a lot of people, and I know I'm going, this is a big tangent, but I think it's an important one, but I think you'll appreciate it, and it is in your policy document. It was so important to me and to this government that when we create OHIP Plus, and the Premier, you've maybe heard that she's committed to full pharmacare in this province, but we felt it was critically important to make sure that it was, we were first payer, that it was truly universal, just like the rest of the healthcare system, well, most of the healthcare system, that just like you shouldn't have to pay to go into an ER or see your family doctor or your nurse practitioner, similarly, we need to look at access to medication that way. So I'm very proud of the hard work and advocacy that RNAO has done on this issue as well. Now, I think, Doris, you're yourself an expert on wound care standards, right? So this is another area where we've made some important changes, as you know, in terms of offloading devices and approving them late last year. And that was really the fact that RNAO has championed this issue for the last number of years. We set up a table through HQO, Health Quality Ontario, to arrive at precisely what the best evidence showed and how we should approach it and how it should be funded. Announced that funding late last year, I believe. But we, equally important, RNAO has spoken about the need not just for wound care standards and offload devices, but RNAO has also passionately, I would say, voiced the need for more access to training and education. So I'm happy to say today as well that we are providing funding for clinicians and planners to attend RNAO's Wound Care Institute this spring. And, you know, and it's, I think, I'm proud of these initiatives, but it needs, you know, it needs to be seen in the context that there is so much more work to be done, and I'm the first to admit that we're fortunate. We have, it's not the best, but we have one of the best healthcare systems in the world. But that, I think, gives us some satisfaction, but also a greater responsibility to continue to invest in it and make it even better. And there's no doubt, and I'm sure many of you can speak to from your personal, professional experience, there's no doubt that there are many, many challenges in our healthcare system today. And we need your guidance and good advice and pressure as well, strong advocacy when it's required, to make sure that we are paying attention to where those needs are, and we're taking advantage of the right opportunities, and we're addressing the challenges that we face. Last year we announced the, with regards to long-term care home, not only building 30,000 more beds over the next decade, but really important, increasing the direct care per resident per day, up to a minimum of 4 hours of direct care per resident per day in long-term care homes, to help ensure not only that residents receive the highest quality of care, but again, so healthcare workers, particularly nurses, have the capability and the supports to be able to practice their profession effectively. So that increase to a minimum of 4 hours per resident per day means an additional 15 million hours of nursing, personal support, and therapeutic care for residents in our long-term care homes. And I promise you that we will see many, many more RNs through this initiative. And I know there's a few other things in the window that you're anxiously waiting to be complete. And I think, to be honest, I think it helps the fact that I'm a healthcare professional myself, and I can't imagine not being able to practice according to my full scope and abilities and training. So we are also ensuring that all, thank you. Whose laptop is this? I'll be careful. So we're also ensuring that all RNs will be able to independently prescribe medication. I should say that again, that all RNs will be able to independently prescribe medication. And we anticipate that the work of the college, together with the ministry, that will be completed in a number of short months. So, and again, remember when we were talking way back near the beginning about nurse practitioners being able to order tests, diagnostic imaging, this speaks to that same issue, right, of patients having better access to what they need and more options around who can help them, let alone that important issue of scope. We're also heading into the third year of the Attending Nurse Practitioners in Long-Term Care Homes initiative, and the good news, and that was a commitment to add 75 nurse practitioners in the first instance into long-term care homes. 60 nurse practitioners have been hired and are in place, and even better news, I think, is that the remaining 15 we anticipate will be delivered and in place in just the coming few months. So there's a lot that we have, I think, to look forward to, and we have together enormous challenges. There's no question about the not only volume and breadth, but the size and scope of the challenges that we face in our healthcare system. But I have to say that it's our positive working relationship in close collaboration with RNAO and with Doris and Carol and others, that soon to be Angela, that relationship has been one that has helped us grow as a healthcare provider, healthcare system, but also as a society that is focused on delivering that highest quality care to the residents of this province. So you've got many people, and I know many are, and many of you are activists as well, which I applaud, and many of you here as members or as part of the executive or leadership positions in RNAO, you remind us on a daily or near daily basis of what we need to do, and also the critical role that nurses play in delivering exceptional health care. You let us know without doubt how committed you are in making our healthcare system more patient-focused. I really have never ever felt for a moment that you have done anything other than put the patient first and to try to build a better, stronger healthcare system that is more accessible and equitable and patient-focused. And you remind us as well of what your profession requires in order to be able to deliver on that commitment in that province, that promise. So I don't have too many chances to say this to you directly, so I want to take this chance to thank all of you now, today, for the work that you do day in and day out, often under very trying and difficult and challenging circumstances, let alone the responsibility that's being given to you to care for individuals and their loved ones and family and friends at such critical moments in their life. And thank you as well to Doris and to RNAO and to Carol for continuing to work extremely hard on your behalf, not only for nurses, but for patients and the people across this province. And let me tell you today that I remain committed to continue our work with you so that we can continue to support our nurses and Ontarians every way we can. Thank you very much.